Most CRNAs go through anesthesia school learning pharmacology, physiology, and ventilators. But one thing we rarely learn about is the political landscape that actually shapes our profession. And the truth is, a lot of the biggest decisions that impact CRNAs aren't happening in the operating room. They're happening in state legislators, federal policy meetings, and hospital boardrooms. Hi, I'm Breezy. I'm a CRNA with a passion for all things anesthesia, skincare, and aesthetics. And in this video, I'm breaking down the biggest political and regulatory issues affecting CRNAs right now, including scope of practice, supervision versus independence, reimbursement policies, physician anesthesiologist shortages, the future of anesthesia care models. And whether you're a CRNA, SRNA, or thinking about anesthesia school, understanding these issues is essential for your career. Healthcare is one of the most heavily regulated industries in the United States, and anesthesia specifically sits right there in the middle of several major policy debates. Why? Because anesthesia care involves questions like who is qualified to provide anesthesia? Who supervises anesthesia providers? How is anesthesia reimbursed? What is the safest and most cost-effective model of care? These questions are not just clinical decisions. They are policy decisions, and those policies directly affect where CRNAs can work, how much autonomy they have, how anesthesia services are delivered, and even how much anesthesia providers get paid. So one of the biggest ongoing political discussions at anesthesia is CRNA scope of practice. CRNAs are advanced practice registered nurses who are trained to deliver anesthesia independently. However, each state regulates anesthesia practice differently. Some states allow CRNAs to practice completely independently. Others require physician supervision or collaboration, and some states sit somewhere in the middle. This creates a lot of variability across the country. For example, in many rural hospitals, CRNAs are the sole anesthesia providers, but in some larger academic medical centers, anesthesia care may involve multiple provider types working together. The political debate often centers around patient safety, access to care, cost of health care, provider training pathways. Organizations representing CRNAs argue that independent CRNA practice expands access to anesthesia care, especially in underserved and rural communities. Other groups advocate for physician-led models. Because of this, scope of practice laws continue to evolve. So one major policy decision that shaped CRNA practice is something called the CMS supervision opt-out rule. Historically, Medicare required physician supervision of CRNAs for anesthesia services to be reimbursed. However, in 2001, the Centers for Medicare and Medicaid Services created an opt-out provision. This allows governors to request that their state opt out of the federal physician supervision requirement if it's in the best interest of the patients. And today, many states have opted out of the supervision requirement. This doesn't mean hospitals must allow independent practice, but it removes the federal supervision mandate. Hospitals and facilities can then determine their own anesthesia staffing model. This policy has had a major impact on rural hospital access to anesthesia services. So another political and professional discussion revolves around anesthesia care models. There are several ways anesthesia care can be delivered. The CRNA-only model, the anesthesia care team model or ACT model, and the physician-only model. And each model exists in different hospitals across the country. The anesthesia care model often involves physician anesthesiologists, CRNAs, and sometimes anesthesia residents or anesthesia assistants. Advocates of different models argue that their approach provides the best balance of safety, efficiency, and cost effectiveness. Because anesthesia services represent a significant cost in healthcare, these models are often discussed in policy and administrative decisions. One area where CRNAs play a particularly important role is rural healthcare access. Many rural hospitals rely heavily on CRNAs to provide anesthesia services. In fact, in many critical access hospitals, CRNAs are the primary or only anesthesia providers. Without CRNAs, some rural facilities would struggle to provide services like emergency surgery, obstetrics, trauma care, and procedural sedation. So when policymakers discuss anesthesia workforce issues, they often look at provider shortages, geographic distribution of providers, and access to surgical care. And CRNAs are frequently part of that conversation. The United States is currently facing healthcare workforce shortages across many specialties, and anesthesia is no exception. Demand for anesthesia services continues to grow because of an aging population, increased surgical volume, and expansion of outpatient procedures. And at the same time, the pipeline for anesthesia providers has limitations. Training programs require significant time and resources. And this has sparked discussions about expanding training programs, optimizing anesthesia workforce distribution, and improving access to anesthesia care in underserved areas. Another major policy issue affecting anesthesia providers is reimbursement. Healthcare reimbursement policies influence hospital staffing decisions, anesthesia care models, and provider employment structures. Anesthesia services are typically reimbursed through a base unit plus time unit system under Medicare and private insurers. Changes to reimbursement policies can affect hospital budgets, anesthesia group contracts, and overall compensation structures. Because anesthesia services are such an essential part of surgical care, reimbursement policies are closely watched by healthcare administrators and professional organizations. One thing many SRNAs or anesthesia students don't realize is how much professional advocacy organizations influence healthcare policy. Organizations representing anesthesia providers work with policymakers to address issues like scope of practice laws, reimbursement policies, patient safety standards, and workforce development. And advocacy can include legislative education, policy research, and professional representation at the state and federal level. This is why many anesthesia professionals choose to stay informed and engaged with the policy side of the profession. If you've learned something thus far in the video, please give it a thumbs up so it reaches other viewers like you wanting to stay up to date on current anesthesia topics. And if you vibe with this kind of content and with me, consider subscribing to the channel so you don't miss out on any future videos. Also, be sure to check out my free case study template in the details of this video. This is a great tool to use in clinical and to follow along with my case study videos that I try to post about once a month here on YouTube. So why all of this matters for SRNAs and new CRNAs. If you're a student or new CRNA, it might feel like these issues are far removed from your day-to-day clinical work. But the truth is, these policies shape where you can practice, how autonomous your role is, your job opportunities, and the future structure of anesthesia practice. Understanding the policy landscape can help you make informed career decisions, understand different practice environments, and stay engaged in the future of the profession. At the end of the day, anesthesia is both a clinical specialty and a healthcare system service. That means the future of anesthesia practice isn't just determined in the operating room. It's also shaped by policy decisions, workforce needs, and healthcare economics. For CRNAs and SRNAs, staying informed about these topics helps you better understand how our profession fits into the larger healthcare system. And whether you're practicing in a large academic center or a small rural hospital, these issues influence the way anesthesia care is delivered across the country. So be sure to check out the AANA website. It breaks down what policies are being fought for per state so you can stay up to date and be a part of helping legislation in your profession. Thank you so much for watching, and I'll see you in the next video.